There's always this tension between the individual's requirements, and it is true that there are always some individuals who are unfortunate enough to have a condition that requires very expensive care or very expensive medication. And the question is, how do you fund it? So I think that it is difficult for me to envisage any community with the ability to come up with the resources to fund sometimes some care that is so expensive that it is beyond the ability of even the community collectively to do it. This is where we should have a whole of society approach where we say that very expensive or super expensive catastrophic care must be in some way eventually be backed by the state. But what I'm also saying is for most of the health requirements of individuals, families, and communities, if we do this well, then the cost will be substantially lower than what is currently seen or experienced by people who are primarily cared for by the private healthcare industry. Wherever it is, whether it's in India or in the United States, the paradigm is the same. Private healthcare is very expensive. In certain areas, it is wasteful because people practice what is known as defensive medicine. They do things not because it is the optimum or the ideal for the patient, but it is a way, a strategy to avoid any kind of blame should anything go wrong. So it's called defensive medicine. That's very expensive. And sometimes that kind of defensive medicine can be injurious to the patient because all of what the patient requires is taking a lower priority versus what the healthcare provider thinks will appear to be the best. So this is the reason why I think that we must change the definition of health. And to do this, we have to start right in the beginning. Because if you have the right definition of health, then we all know what we are working towards. If the definition of health in and of itself is flawed, then we'll be meandering all over the place doing all sorts of things. If we had adopted the right definition of health, which is a combination of the Myers model and the salutogenic model of health, I think that that is a start.
So,
The other part, which I think is very important, is that whenever we talk about health, it cannot be a purely biomedical construct. Health has to be something that is built as a shared vision between the healthcare providers and the healthcare beneficiaries. And this should be a participatory arrangement, not a transaction where the healthcare provider is the benefactor and the healthcare consumer is the beneficiary. So that kind of transactional relationship is not conducive to good health.
So again,
So we have to change the thinking behind this.
so how do we, for a layman, how do we define health? As in, we ask them to exercise daily, drink lots of water, or do not
No,
consume oils,
no,
saturated
no, no,
fats.
no, no, no. Those are all the tactical things that one may or may not necessarily adopt. Okay, it all depends on what kind of person you're dealing with, what the individual requirements are. Today, we are in the era of
Yeah.
personalized precision medicine, which means that every individual is unique and distinct. What is good for that specific individual may not be good for another individual.
Because
But what's the goal? What's the vision? The vision is that health is defined as the ability to meet the demands of life. That's the Mycoach model.
okay.
And the salutogenic model focuses on all of the causes of good health rather than be distracted by the causes of poor health, which is the old paradigm, the pathogenic paradigm. The salutogenic model of health says that we must focus on the causes of good health.
Causes of good health.
Yes. What are the reasons why somebody will enjoy good health? Well, clearly, proper nutrition, proper exercise, proper sleep are conducive to good health. So we focus on that.
The community or the smiles
It's
or the
whatever
laughter.
it is, whether it's an individual or a family or a community.
So was
And good health doesn't begin and end with just humans, because if you don't take care of the animals in your environment, that's a hazard to your health. The number one cause of rabies in this country is feral dogs. And these dogs are not immunized against rabies. If those dogs are mistreated, they attack humans.
so there's a
But if
cycle.
the dog is immunized against rabies and the dog is treated kindly, and the dog will not attack a human being and bite a human being, and the dog is immunized against rabies, the dog will not transmit rabies.
Okay.
And rabies is a fatal illness. Now, humans cannot have good health if they are living in a polluted environment.
Which is true. Yeah.
So, One Health requires that we integrate human health with animal health and environmental health. So, the salutogenic model says that we must focus on the causes of good health. You will have good health if you are living in a beautiful environment. The ambience contributes to your emotional well being.
Which is true. Like it could
If you
be.
have an affectionate dog, that contributes to your emotional contentment.
Yeah, the happy hormones get released, right?
Right.
Like the endorphins. What do you call the
Endorphins, yes.
oxytocin, serotonin,
Whatever,
dopamine,
there's so
whatever.
many of them, right?
Yeah.
So, what we need to think about is the fact that when you talk about health and you talk about one health, one planet,
Yeah, these
all of
websites.
this is what we call a complex adaptive system.
Okay. So
So,
you brought this domain which year, sir? The One Health
happen for
one
onehealth.org.
happen for onehealth.org was
That's about maybe 10 years old.
10 years ago.
Yeah.
Loka samasta sukhino bhavantu. So you wanted everybody in the world to be happy, which is like, but we say in
Well, it's
India,
not the world. Lokaha doesn't mean the world. Lokaha means all of creation.
oh, the universe.
More than the universe, the multiverse.
So, oh God, you believe in parallel universe?
I mean, it's not a question of what I believe or not. I'm telling you what the definition of loka means.
Okay. So it's multi-universe, samasta, like Sukhino. So let everybody
So
stay
there,
happy.
it's a rough translation here that in all of creation,
Needs to be.
everywhere, okay, sukhino bhavantu, let there be joy. And I add, let there be tranquility, because you cannot have joy without tranquility.
Okay. What about other basic living organisms which cause trouble to us, like the mosquitoes? Or let me close that mosquito shield. I mean, what could be the reason when we say all, so that we can prevent other insects coming in? Okay, this is, yeah. Please continue, sir. As in,
Mosquitoes are food for the birds.
really.
Yeah.
But how can we be joyful when they get in and occupy our freedom or our environment? As in,
Very simple. Reduce the factors that increase mosquitoes, which is, puddles of water here and there, proper drainage, proper landscaping.
so one thing which really hates me is mosquitoes and cockroaches, probably the lizards and all.
So,
Sometimes I wonder
so you have two options.
to be cleanly.
One is change the environment so that the population of all of these animals which cause harm to us is reduced, and then introduce a natural predator that will eat them up. So, for example, if you really don't like all these little
Cockroaches or
insects,
insects, yeah.
cockroaches, and
Yeah.
mosquitoes, introduce a lot of birds that eat them up.
Oh,
And the birds give you pleasure. They're beautiful to look at.
so the word salutogenic, the word salutogenic meaning?
Salute means health.
Oh,
Genesis is to generate. So salutogenesis, as opposed to pathogenesis. Pathos is what is bad or poor or hurtful, right? Genesis. So pathos is roughly translated into ill health or disease. And Genesis is Genesis, the generation of.
yeah,
So the
pathogen.
traditional way of teaching medicine or health is what we call the pathogenic paradigm, where we focus a great deal on what has gone wrong, what is the causation of that ill health, and how do we attack that.
So
What Aaron Antonovsky says is that it is just as important, if not more important, to focus on the causes of good health.
so is he a physician?
So I
Aaron?
cannot, yeah,
He's
Aaron
a
Antonovsky is an
sociologist.
Israeli medical psychologist.
Yeah, I see.
He passed away.
Yeah, in 1994.
Yeah.
Israeli American sociologist, work concerned the relationship between stress, health, and well being. Wow. I'm just reading it from there. So,
Yeah.
so the triangular model, does it come from his
कौन है?
salutogenesis?
आ गए? ये
That's
दोनों
okay. That's okay.
उनके
let
उनके
it-
साथ कौन आया और? हाँ.
That's okay.
डैडी हैं सर मैडम को
उनको चाय कॉफ़ी पिलाओ, बोलना मैं मीटिंग में हूँ, आधे घंटे में आऊँगा.
So Mike Rich is he also like a sociologist or
Who? Mykerch?
Mike?
Mykerch is a small town very close to Geneva in Switzerland. Mykerch really is German for my church.
Oh,
Okay, the village name is Mykerch. And Bircher and Hahn, who first postulated this model, they named it the Mykerch model. There is an organization called NISADRI. It's a new youth social activism development research institute in Odisha, NISADRI, NYSADRI. And this organization adopted 100 villages in Odisha where they have implemented the Mykerch model.
And why?
NYSADRI, nisadri.org,
Whoa.
National Youth Service Action.
National Youth Service Action and Social Development Research Institute. Wow.
So I'm not talking of something very esoteric and completely abstract, all right? I'm talking about a concept and an entire vision that has been implemented
So
already.
they're part of social work and journalism also.
Yeah, they do a lot of things. They've tied up with a hospital that provides free eye care.
So this is amazing. I mean, this is like a ocean's depth, as in the whatever I had been through the website made me like this one happen for One Health, and the way you explained happen. So the goal is One Health through this salutogenic model, anchored in social justice, as in respect, partnership in shared vision, problem driven iterative adaptation. So the goal is again to reach physicians or to empower physicians or clinicians to reach the underprivileged children or the rural societies. Or
I see, if we focus only on physicians, it's too narrow a focus. So I
Yeah.
think we should focus on everybody. So this video is all about how and why I started this concept of happen.
Okay.
What's the rationale for the happen program?
So this is again the
It's on
roots.
YouTube.
Yeah. So the adaptive systems is high reliability adaptive systems. So we are targeting like everybody. But when we say we
but what I would say is, you know, it's important to not to try and attempt to boil down the ocean.
Nice analogy, yeah.
So we need to focus. So there are two specific areas of focus that I am focusing on. One is empowering nurses. In fact, right now I am involved in the design of a healthcare facility that will be primarily be staffed by nurses and run by nurses, because I am used to very well trained nurses doing 95% of the work, routine work. I don't need physicians. I need a few physicians just to do some work that nurses cannot do at the present time.
Like surgeries or the complicated.
Even surgery also nurses can do if you train them. Christian Bernard, who did the first heart transplant, okay, he himself did not understand the anatomy and how to do it and all of that. There was an anatomy technician, an African, a black guy, who came and helped him do it
Christian Bernard. Okay. Which year was this, sir?
in the 1960s.
Oh, wow. Okay.
Because in those days,
So there was a
because of apartheid, the local Africans were not allowed to specialize and become doctors and surgeons, etc., etc.
I heard
But
that.
this man was a master in anatomy. He was basically a technician who helped medical students learn anatomy.
Whoa.
So he helped
Dr. Richard Branson.
Christian Bernard
Christian Bernard. Okay.
do the first heart transplant.
Dr. Christian Bernard.
So one area of focus is really to empower nurses. And
It should come up here in Hyderabad or some other city.
well, the healthcare facility that I'm building is about 90 kilometers away from here.
Near
Actually,
Shamshabad.
no, it's near Shadnagar. So, and it's basically the way I'm building it is like a resort, primarily to help people recuperate from their illnesses. But it'll be primarily be staffed by nurses and run by nurses, with maybe one or two doctors. That's it.
Like naturopathy.
It's a combination of naturopathy, allopathy, Ayurvedic medicine, everything.
Wow.
It's what we call integrative medicine.
Like a holistic center.
Right, right. That's one part. The other part that I'm focusing in on a lot is helping people who want to get into the area of, development. So, like the other day, we met all of these young entrepreneurs. A lot of young people have ideas and they want to do things, but what they don't necessarily know is exactly how to go about doing it.
Execution or implementation.
And that's where I have expertise. I can give people guidance, so how to conceptualize, how to start building the infrastructure, how to start thinking about actually executing. And that's an area that I think we can all get together and support a lot of young people. How to go after funding, how to go after resources, how to think about should it be for profit, should it be not for profit, right? Because I've done all of that. I have set up 3 for-profit enterprises that are all profitable. I've set up a not-for-profit enterprise. I am working in yet another not-for-profit enterprise.
Not for profit is this one only, right? So the one.
Yeah, the Happen is
Happen for
as,
One Health.
yeah, Happen is not really a organization. It's a program. It is
Okay.
sponsored by a lot of other.
Yeah.
So Suvarna Swasthya is a for-profit entity. Enrich is a for-profit entity. Guide Health is a for-profit entity. But Icha is a not-for-profit entity.
Okay. Icha is something which I had seen.
Yeah. So it's, if you go all the way to the bottom, you'll see Icha.
Icha.
Go to About Us.
Okay.
And then go to the bottom. Oh no, where is it? Or maybe it's on the main landing page. I forgot.
Okay. Yeah.
Yeah, it should be on the bottom.
Icha is like.
Icha is a Section 8 company.
Okay.
I don't know where it went off to.
It's okay. I think that's a different website.
IchaIndia.org.
Yeah.
No, Icha India, all one word. Icha India is one word.
Icha.
No, IchaIndia.org.
Okay, sorry. Icha India. Icha India.
.org.
No, we get it.
.org. Yeah. No, yeah.
Yeah.
Yeah, this is our website. This is a Section 8 company.
International Human Health Advancement. Okay. This is the team, Dr. Ganesh, Dinakar. So, but this is one of the HR centers, as in.
Yeah. So all the corporate headquarters is over here.
So we train individuals or the underprivileged, or is it
So
Cardio works.
HR basically uh, works on everything not for profit, charitable care, training, support, health,
Okay, the
health
CPR.
program. Yeah, we've done a lot of different things, but most of what we do is HR really manages the Happen program. We
So,
also do we also do medical education, and we also support people with diabetes who need insulin and medication. So we support that too.
okay, now tell me your routine. In fact, I would like to adopt your routine. It wouldn't be like copy paste, not red wine, but if I visualize myself for 2047, like 100 years of Indian independence, what should I be doing? Probably,
The first
I
thing
prefer
to
one
do,
meal a day.
so the first thing to do is, be clear about your vision. What is it that you want to see? Because once you have clarity about your vision, okay, then the mission is to work towards that vision.
Yeah, apart from the vision and vision, first I thought I'll take this machine into something more profitable or more adaptable to the environment. As in, how should I probably people say eat healthy, eat fruits and vegetables and all that. I know that your body fat percentage is too low because more of masculine nature. And I was
Uh,
shocked when you didn't have anything upstairs in Raper or you were not. In fact, I was shocked that you didn't consume water for hours. And how
yeah,
do
but
you stay hydrated?
yeah, because early in the morning I drink enough fluids and I have breakfast so that I can last until 6, 7 o'clock in the evening.
Seriously.
Yeah.
So is this a myth that we should drink some water every 2 hours, every
No,
one
no,
hour?
it depends on different people. Different people have different requirements. It all depends on, again, individualizing what is best for that particular individual.
Okay.
So if there are people who need to have more fluids or need to eat more frequently, that's fine for them. There are people who need to eat less frequently, drink less fluids, that's fine for them. So you have to personalize everything.
Okay. So it's individual again,
Right,
based upon their habits.
right.
So if I had to get your cheat code, what's your daily routine like? So you get up like 5 or 6 or 7 in the morning or 3 in the morning.
Usually wake up around 4:35,
You
and
consume
then
liquids like
yeah, and
drink
then
one.
I have breakfast with coffee, and then I'm ready for the day.
So no sugar, no salt.
No sugar, very little salt. Salt is basically what is in the cooking, nothing added on top of it.
The sodium levels needs the body needs.
And millets. So avoid rice, avoid sugar.
Okay. All carbs.
Hmm?
All carbs like carbohydrates you
No,
avoid all.
no. I mean, I do eat carbohydrates, but they are millets, and they
Okay.
are limited in quantity.
Okay.
Yeah. So every day it's like a little bit of millets, little vegetable, little dal. And that's about it.
You mix and match with fruits and vegetables, raw,
Yeah,
cooked, steamed.
fruits. So
But evening.
it's again it's I eat what is enough for me,
Okay.
and everybody is different, so you
And
have to yeah
so
you have
lunch.
to sort of arrive at a regimen that maintains proper body weight and
Yeah.
body health.
Like the BMI.
Right.
So again, no biryanis, no buffet lunches.
No, I do. Basic once in a while, but
Not
not on a daily basis. No.
okay.
Yeah.
And evening you go to bed like you.
I'm usually asleep by around 9:30. 9:30 I'm asleep. I usually read after dinner for a
Dinner
couple
is
of
like
hours.
before 6 or 7 or
Dinner is usually in between 6 and 7:30.
Again, soups, fruits, vegetables, or
No, just dal, vegetable,
dal khichdi.
one roti, and that's it.
Okay. And one quick feedback on Herbalife Nutrition. I invested like a couple of lakhs, probably 6 to 7 lakhs in Herbalife Nutrition. I had given up right now because I feel that afresh. You might have heard about Herbalife, right? The
Yeah,
shakes.
yeah. I don't have any idea of how good or bad it is, but what I tell people is if it is not natural, avoid it.
Okay.
Have you seen any birds create juices, fruit juices, or herbal juices? No. The bird eats the
Raw.
little fruit or nut, and that's about it. So, which animal have you seen making herbal juice and
Yeah, that's a good one.
right?
So
So,
with
I
rest,
stick to nature.
so the only thing is, so we should start our shows as in with respect to uh, not only Aronofsky or Matrix model, uh, HI India, probably with whatever we are doing with Happen for One Health. Um, as in, we have a curriculum around this, sir, or is it all like
Yeah.
now all these probably they might be active in their own terms, as you mentioned. But that's okay. We'll take it forward. I don't want to keep the other doctors or physicians who just came in. I don't want to keep them waiting, but I'll hold. I mean, I can wait.
Yeah.
Probably go through Hall of Fame or other credentials or the books which you have, including the Ratan Tata book which I had seen in the first floor. Um, as in, so you travel every week, sir? As in every week or
No,
every?
I have to maybe a couple of times a month.
How did you get to know about Harun Phillips, the Dream Starters, about the Draper startup? How did you get to know about that? I did want to ask you that.
He contacted me, I think, through LinkedIn.
Seriously, Harun Phillips did that.
Yeah.
And
I
he
don't
said,
know how he came to know.
so he just said, sir, can you join us and all that? That's it.
Yeah. So,
I mean, if you, so again, my wish is to spend more time with you, not to get the golden nuggets, but to experience life from your perspective and angle. As in, I can
well,
always,
whatever you want to do, I think there are two couple of things that you should think about. Hey, like I said, the vision. But just as importantly, how are you going to fund it? That's equally important because otherwise it will just remain a dream
like,
that
a,
is never, you know, a tangible reality.
yeah,
A
like,
dream that does not convert into a tangible reality eventually becomes a nightmare. So, this is the key that you have to think about. How do you take an abstract concept, which is a vision, and convert it into a tangible reality? That requires resources, it requires support. Now, in resources, one of the resources that you do need is money. Others
fun.
are ideas, people, collaboration. Just money alone won't do it. You can have all the money on earth and not be able to do what you want to do if you do not have other people join you and other people helping you, right?
Yeah, we will get the sponsors or we'll get people
Yeah.
funding. Mainly the pharma is the biggest. You know how the pharma market is. We'll get sponsors.
Yes and no, because again, remember that one has to be careful about what kind of sponsorship and what kind of funding you accept. Because if it comes attached with a quid pro quo, and that quid pro quo is something that makes you, compromise core values, then you become a whore.
You follow Dr. John D. Martini? Like, Doctor, have you heard about Doctor?
Yeah.
We follow him, as in he talks about the importance of core values,
Yeah. So,
uh,
so this is
sticking to
very
our values.
right. So, you know, is it because what happens is that if you adopt foul means towards your end, it doesn't matter how wonderful the end is. You have now completely polluted it and contaminated it. So the process is very important. The means actually should contribute to the virtue of the vision,
Yeah, the current world needs
right?
the kind of tools which you had experienced, as in not
Right. So
as
that's why what we say is it is the virtue of the temple that brings in both devotees and divinity,
very true.
right? So we cannot compromise on that part. So what we have to do is we have to be patient, to keep working on the messaging, get it across, and we have to network and add more and more people who are willing to do the same and collaborate. See, the other day we saw a lot of young people doing a lot of wonderful things.
Yes.
Think about the incredible amount of synergy there. So we bring everybody together and everybody is helping out each other and supporting each other,
Mainly through
you know and
the
some
kind
of
of
those people, I think, would benefit from understanding the standard tools of organization management and how to think through processes. What is implementation science? Because it is a science, all right? That's a lot of this work has not been done by healthcare professionals. A lot of this work is actually done by developmental economists, okay, at the World Bank and other people. A lot of this work has been done by sociologists. A lot of this work has been done by other, you know, industry professionals. The entire science of Six Sigma and the science of safety was really perfected by the aerospace industry and the nuclear industry, not by healthcare, which is very interesting because you would think that human life being so precious that health professionals would invest in these sciences and these disciplines, but they did not, and they still don't.
aerospace industry, as in travel and
Ah,
how come nuclear? I'm like shocked to hear nuclear. I mean, is it again the
because
war?
because think about a nuclear power plant. You make a minor mistake, the whole place blows up.
Yeah, that's true.
Catastrophic. So, but what is the science behind that reliability? What Six Sigma really means is less than 3.5 errors per million operations. How do you get to that? There's a methodology. And unless you adopt that methodology, you won't get it. Our airlines, our nuclear industry operates at a Six Sigma level. Our ISRO scientists put a satellite around Mars in the first attempt. That is not Six Sigma. That's an order of magnitude greater than Six Sigma. It is Seven Sigma. That kind of accuracy, precision, and reliability.
So
So
if
these are tools that people need to at least be familiar with, even if they don't master them. They should at least know that these tools exist and this methodology exists.
so if we have to train folks, uh, again, you prefer apart from, as in, if I had to have happen for One Health a 3-day course, we would target only women or
I
we would
think
target?
that what I want to do is have one course just for nurses, training them on patient safety. And part of it is also infection prevention and control. Now, there is a course run by the University of Hyderabad, the IFCAI, on infection control. So, generally, I encourage people to take that course. It's an online course, not too expensive. It's maybe some 60, 70,000 rupees. It's a 2 year, 1 year or 2 year course. I forget that. Right. But I want to create a very distinct course just for targeted and tailored for Indian nurses, nurses working in India. Because nurses working in India work under a very different environment, under very different constraints from nurses in the United States.
Which is true.
All right. So, how to help them become skilled, confident, capable, and hopefully some of them actually become entrepreneurs and make a lot of money.
There you go.
All right.
That's the one, because
Yeah.
they're so undervalued,
Right.
because
So,
I'd seen it close.
so this is one part. The other part I want to focus on, all the people like the people that we met the other day who have dreams, but they need to understand how to convert their dream into a tangible reality. And for them, a totally separate skill set that they need to learn.
You need entrepreneur mindset.
Well, more than the entrepreneurial mindset, they need critical thinking skills, analytical skills, communication skills, and how to organize themselves.
Yeah, the management, self-management, as in. So online or through LinkedIn, I met this nursepreneurs. They are like 50,000 nurses, but they're not active. I don't see them active. But nursepreneurs, if I search nursepreneurs, but I'll
Well, see,
also wait.
they need to become people who can make a lot of money, because this is the only yardstick that matters. And look, every nurse sooner or later will become a parent, whether it's a man or a woman, it is irrelevant.
That's true.
And as a parent, they will need to fund their family's education and their family's welfare. They need a roof over their head, and their children need to be educated, and that costs money. And the pay scales are so poor that they will not be able to afford the kind of living environment or the education for their children, even if both the spouses are working. Unless one of the spouses is already very well paid and wealthy and so on. So
That's true. So this is nursepreneurs, sir, nursepreneurs.com.
yeah.
So nursepreneurs.com, they say it's business training for nurses. Again,
But this is not India.
no, this is in US only. They have
Yeah.
like 50,000 plus community.
No, we
They
want
say
India.
that's what
I
I'm.
want to focus on Indian nurses. And I want to do two things for them. I will give them the option. Either I give you the skill set, okay, that equips you to go out and get a better job outside India, whether it's in the Middle East
Middle
or
East.
in the Europe or wherever. That's one. And if you attend my course, then I will personally certify that you have attended my course. And if I just sign my name, it doesn't mean too much. But when I add my title as a full professor at the University of Illinois, that adds a little bit of credibility. And I will say that when you are applying for a job, I will write a personal letter of reference for you.
Yes. And if we launch a course now, this lady had launched a book for nurses, but that's again $24. This is what she says. It's turning nursing expertise into a profitable business. But I know what goes into this. It's about the mindset blocks, decisive action, guidance, and all. This $24, this is like a hook. So they get the book, but end of the day they have to create their digital assets. So
So see, there, all of this is all,
marketing tactics,
yeah,
strategies.
yeah, and I don't know whether it really works, because let's face it. Okay, what do I want a nurse to be? I want that nurse to have the skill set for doing all the basics. So every nurse needs to be trained in basic life support and advanced cardiac life support. These are two things that are absolute essentials. For that, we'll collaborate with people who are actually certified providers of that kind of training. Number one, AHA recognized, American Heart Association. Second, they need to learn basics of critical thinking and patient safety. Third, this is the most difficult and the most important thing. They need to learn how to handle power differentials.
Power?
Power differentials.
Okay. I
Okay.
thought it would be compassionate care.
No,
But
how do you handle a hotshot doctor who's trying to do something and is ordering the nurse to do something that everybody knows is not good for the patient?
yeah, kind of anger management or doing something
No, that's,
hotshot, as in showing
yeah,
aggressive behavior.
whatever. I mean, you see, the point is that in every hospital, the doctor is up here and the nurse is down there.
They've been treated
Okay,
without.
so how do you make that nurse who's down there have the skill set to manage this fellow?
Oh, okay.
That's how you handle a power differential.
Now I get it. So bridging the gap, not only in credentials or
Not,
knowledge.
not just bridging the gap, simply having the skill set to neutralize some bully.
Yeah, kind of self-respect for the kind of. Awesome. So if a nurse had to go through the course, I'll call it a 3-day course.
Yeah.
And probably it'll be a 3-day video course. And people will take it up, or I have the webinar selling formula because I come with a marketing background. If some nurse had to take up this 3-day course, we would price it anywhere between $100, which is again 7 to 10,000 rupees, because that's the clickbait, or probably it's a tripwire. We call it tripwire, as in it's a low hanging fruit, so that the nurse will enroll. So we need a 90-minute, like your YouTube videos. I would record a 90-minute webinar.
Yeah. So usually, and that's what everybody does.
It's a
But
webinar.
I would propose a slightly different way of doing it.
Okay.
Do it live. We'll have a group of nurses and
We
it'll be
can.
interactive, but we have to pick nurses who are going to ask a lot of questions and make it very interactive.
So let's make it.
So for example, I will ask a nurse, what are you going to do when the doctor has written a prescription for a medication that the patient cannot tolerate or is not good for a patient? What are you going to do? So the nurse has to tell me, and then the nurse will challenge me. What should I do? What would you do? Right?
Yeah, more than question for question, instead of proposing an answer. Probably it comes through experience, as in it's not
Because
superimposed.
all of my training, and I've been training nurses in Hyderabad for the last 15 odd years. Okay,
Wow.
in a lot of different hospitals.
Okay.
Right? Yeah, and the way I do it is multilingual. It's very interactive. It's English, it's Hindi, it's Telugu.
Seriously.
Yeah, all three languages.
Okay.
Hindi matlab Hindustani,
Hamara Hyderabadi Hindi.
Hyderabad. And I encourage them to ask questions. For example, the other day I was uh, training, I was talking to nurses and talking to them about the importance of using sterile gloves when they are manipulating central lines. And this nurse got up and said, but, you know, we are not allowed to use these very expensive gloves. We are forced to use ordinary gloves.
Yeah, the use and throw or the
All right.
disposable gloves. Yeah.
Yeah. So it started a dialogue. Okay. What do you think is more important? A little bit of money and trying to face the hassling of the patients and the billing department about extra charges, or ensuring that the patient does not have a life-threatening illness? So do you realize that if this patient gets a bloodstream infection from that central line, regardless of what gorilla mycin you pour into him, there's a 40% chance the patient will not survive? Are you willing to take that risk for a few hundred rupees extra charge? And that's all it is. One pack of sterile gloves is probably another 300-400 rupees.
Which is true.
When the patient is getting charged tens of thousands of rupees per day, what is 300-400 rupees
Which is
for ensuring that he doesn't lose his life?
so when you go to colleges, or do we have any recordings in these DVDs or CDs? Or like you have any past course modules of nurses, like training nurses, or maybe
No,
anybody else?
all of the most important things I have on my website, the happenforonhealth.org.
Yeah, the same.
Yeah, that happen conferences. Look at happen conference.
So
So
this
there
is
are a whole
again.
bunch of
Oh, these are all the live.
videos that I have put.
Okay, so I'll repurpose this and I'll wait for these other clinicians who are waiting downstairs, maybe the doctor and his spouse.
Yeah,
And I can carry this, right, sir?
yeah,
This one.
absolutely.
I'll just make something now, probably the marketing side. So the course will be under Happen for One Health. So if somebody had to join this,
Not necessarily. We can, I mean, we can,
have an MOU.
yeah, we can think about packaging it any which way. So that's why I started out with this concept of HIRAS,
Okay.
or you can call it HIRAS. HIRA is a gem.
Okay. The
Health
HERAs,
data.
high reliability adaptive systems. So if somebody had to take up a program at Happen Club, or if somebody had to be part of Happen Club, they have to
Yeah.
fill in the information and, I mean,
I
are
have
they?
to activate this. So right now the Happen forum is not very active. Neither
Oh.
is the Happen Club, because I just don't have the bandwidth to sit down and do all of these things.
Okay.
And I need somebody to help me do it who has a requisite skill set. So I
Okay.
used to have somebody, but she went on maternity leave.
Okay. But again, so is this all like Zoom live or
Yeah.
YouTube live, Zoom live?
So they were first, uh, I used to have periodic conferences with my entire group of roughly around, I have roughly around 200 odd people working for me. So out of which about 50, 60 people used to attend these conferences, which I called organizational learning conferences.
Okay.
So these conferences are recorded. They were all on Zoom, and those recordings I put on
YouTube.
YouTube.
So, which is good as in,
And I have my own YouTube channel.
yeah, this is
which
what I
has-
see. Vijay and this is
Yeah.
the same YouTube channel.
Yeah, and I have a lot of other videos also on.
Yeah, I did watch these videos, and the one which really touched me is the nurses again. This one, tribute to nurses. This 12-minute one, but we will. This is really good, as in. But why 5977, sir? Any reason?
I don't know. They just came it.
Kept it.
Yeah, that's Facebook. I mean YouTube. YouTube came up with that ID. I didn't.
But we can change that in one click. But that's okay. As in, we'll come back to a handle, or this is like permissions. Yeah. So you're the owner there. But that's okay, as in we will, or this is okay, this has been inactive or it was active only 2 years ago.